This presentation is about the effect of PTSD on military personnel. So an overview of PTSD. Post-traumatic stress disorder is caused by a traumatic event that has happened to an individual. Symptoms can begin anytime after the person has experienced a traumatic event, and you have to have the symptoms for more than 1 month to be diagnosed. So some of the symptoms could be flashbacks, fear of socialization, isolation, anxiety. For veterans, chances of having PTSD is increased by 3 times, mostly during deployment, than civilians. So looking at the neuroanatomy, to look at the difference in PTSD and trauma-related incidents, the changes in gray matter is observed. Results will show that there is a reduction in gray matter in the prefrontal limbic striatal system in PTSD than trauma. So there's more of a reduction in PTSD. One methodology we use, and probably is the most easiest to use, is an fMRI, which allows us to find more certain parts of the brain that we need, more localized and spatial, so it does tell us what activity is going on, and it can also help us with treatment, as we can look at the response in the brain over time to see if the treatment is actually working. So, the study I chose talked about detecting PTSD early on, so seeking treatment right after a life-changing event has happened instead of waiting. And they saw that in combat militants, gray matter reduction was seen in the left middle gyrus, which is in the prefrontal cortex. The prefrontal cortex actually controls decision-making, personality, and impulsiveness. So one of the conclusions that they found is using an fMRI early on significantly helped the individuals in their treatment, and different parts of the brain is affected depending on the reason you were diagnosed with PTSD, which basically means that if you were diagnosed with PTSD because of being in the military, anatomically it would be in a different area of the brain than if you were diagnosed with PTSD because of a car crash. So looking at whole body systems, there are 3 subtypes of PTSD that military individuals usually face. It's internalizing, where the person keeps their distress themselves; externalizing, which is people who are very impulsive in their decision making; and low severity. The symptoms of PTSD are manageable and more easier to treat. Some factors of PTSD, or some factors that can make PTSD actually start in individuals, include no social or family support. And some of the parts of the body that are affected, individuals have a higher amygdala and lower hippocampus response when with PTSD. And PTSD can also cause immune inflammatory dysfunction like systemic immunoinflammatory phenomena and inflammation of the nervous system, which basically means that their immune system isn't strong enough to fight any infections. Looking at the neurochemical aspect of it, PTSD is heavily defined by endocrine, nervous, genetic, and epigenetic factors. Mostly, researchers look for neurofeedback in the brain to determine the severity of the PTSD. And studies have also shown that individuals with PTSD have a smaller hippocampus. Some solutions. One of the solutions that has shown a lot of promise is cognitive behavior therapy. And all patients that are diagnosed with PTSD are usually prescribed SSRIs, which has shown a high amount of improvement. Thank you for listening.